Thank you, Dr. S.M. Abbas. Before moving on to our next session, we would like to introduce you to a very important section of our colorectal surgical unit and CDBWA. We have a registry, a website, nrcrc.org, how we function it and how we register patients in an online system to track them down. We would like to introduce you to our website, and for a short speech, I would like to invite Dr. Aqeel Azmi, Senior Resident of Colorectal Surgical Unit Ward.
May I have your attention? This is Dr. Amjad Siraj. मैं पर्सनल रिक्वेस्ट है मेरी कि आप अपने मोबाइल से ये जो नेक्स्ट स्लाइड आएगी उसकी तस्वीर खींच लें, इसलिए कि आप मुख्तलिफ ऑर्गेनाइजेशन से ये हमने कैंसर रजिस्ट्री बनाई है कोलोरेक्टल कैंसर की. जस्ट वन पिक्चर एंड देन यू आर ऑफ, यू नो. उसमें क्या है कि इसमें एक छोटा सा 1 मिनट डेमोन्स्ट्रेशन है, सिर्फ वो देख लेंगे आप. तो अभी हो ये रहा है कि सिर्फ हमारे अपने ही पेशेंट्स हम उसमें रजिस्टर कर पा रहे हैं. इट्स एन ओपन फोरम फॉर द इंटायर कंट्री. हर आदमी को अब ये अच्छा फोरम है कि सब जगह बहुत शहरों से लोग आए हुए हैं. इरफान आया हुआ है, पेशावर से, लाहौर से लोग आए हुए हैं. तो सबके लिए ये मैंने इसीलिए मैं ये एजेंडा पे नहीं था, लेकिन मैंने जानबूझ के सिर्फ 1 मिनट की एक प्रेजेंटेशन ये देंगे, वो प्लीज़ गौर से सुने और तस्वीर खींच लें उसकी. उसमें पासवर्ड आएंगे, फिर वो याद रखना मुश्किल होते हैं.
Assalamu alaikum everyone. So I'm just going to demonstrate to you our website. This is nrcrc.org, as you can see. And what you have to do is you first have to send an email to that website, to the email down below, info.nrcrc@gmail.com, where we will give you an account, like we'll sign you up. So right now, Professor Amjad Siraj Memon is here. So I'm signing in through his account details. Sorry. So basically, once we sign in, you get this dashboard which gives you these basic statistics. And so what you have to do is, if you have a patient that you want to register, you go to this link here. It says register patient. Once you decide to register a patient, then you have all this biodata and all these other basic information, and then you keep going next. So for example, here we have a patient who I just put in, and so it gives you fields to fill regarding his chemo treatment and his superoperative findings. Also, there are CT, MRI findings you can put in. Then once the patient comes on follow-up, you can add in and edit this data so that you can, if there's a recurrence, then you can put that in as well. And you can easily edit this data. This is how you edit the patient information. And regarding the history, you can edit the history and the investigations. The good thing about the investigations is you can even upload pictures of the CT and the MRI so that you have like basically it comes up like this. So you can always access it at any time. And it's very easy to use. It's a very simple web-based application. You can use it on your phones as well. All you have to do is just log in, and then you can access this and then register the patient. Once you have a list of patients, then you can, this is like, let's say you have about 10 patients, so you have a list here. If you want to search for any particular patient, you can just add in their name, and then it will come up, and then you can edit, you can view their record, you can add any attachments. Let's say a new biopsy report has come, you can attach that. Let's say a patient has come on follow-up, you can add their visit as well. So it's a very simple website to use. I just request all of you to please take a picture of this, nrcrc.org, and also you need to send an email to this email address so that we can sign you up on your own record for your own account. Thank you.
Thank you, Dr. Aqeel.
Lectures and discussions by pioneers and experts of the field will surely go a long way to educate junior surgeons and refresh knowledge of the experienced ones. The Colocon 2022 has focused on the aim to provide a forum